Hi everybody, it's Honest John, and continuing in my mental illness series of videos, we're moving on to bipolar disorder, which sometimes is called manic depression. It's a mood disorder characterized often by disruptive mood swings. Usually there are episodes of depression alternating with manic episodes. Now, symptoms of depression were covered in my previous video, which is called depression. Uh, Manic episodes, the individual becomes is very energetic, impulsive, erratic, grandiose. Judgment is grossly impaired. I once worked with a patient who spent years building up a business only to drive it into bankruptcy during her first manic episode because she went on a massive spending spree. So it was heartbreaking, it really was. Sleep disturbances are common. In severe cases, psychotic symptoms such as delusions and hallucinations may be present, which can complicate the diagnosis because the doctor will think that they are schizophrenic and use the medications used to treat schizophrenia, and then that delays recovery because they're not really that effective. Severe manic episodes may result in violence in people who would not normally become violent, so that can be a difficulty. Now, usually there is a period of normal mood between manic and depressive episodes, but in some cases, patients shift from mania to depression and back again. This is called rapid cycling. In some cases, a person suffering from bipolar disorder may only exhibit manic symptoms or only symptoms of depression. And so this complicates the diagnosis. Sometimes the only way to determine if a patient is bipolar is by doing a trial of mood stabilizing medications and seeing how they respond to them. Sometimes manic episodes are preceded by what's called hypomania, in which the patient is very high functioning and productive. And so it's people around them might see them as really doing well when actually they're heading for a manic episode. By the way, these people are the ones who will talk your ear off. Episodes of hypomania can last for months and years and may be confused with being the patient's actual baseline state. Sometimes bipolar disorder takes the form of what is called mixed affective disorder, in which symptoms of both mania and depression are present. So the person may be depressed, but they'll have racing thoughts, anxiety, agitation, and way too much energy. And naturally, people in manic and hypomanic states have a low attention span. The causes of bipolar disorder appear to be genetic. There's a strong correlation in family history, but environmental factors may contribute. Stress can bring it on. Drug use. There are many cases where people have never had a manic or depressed episode until after they use drugs, and then all of a sudden the disease is triggered. It's like it was like lying dormant and jolted awake by the use of street drugs or overindulgence in alcohol. Now, the approach of the staff varies with the state of the patient. If the patient is depressed, you do the things that you do with a depressed patient. Um, a manic patient, well, they may be too disruptive to be in group therapy and unable to benefit from individual talk therapy, so you try to assign tasks that will focus their attention. And you have to kind of ride herd on them to keep redirecting them back to the task at hand. Now, during a manic episode, sometimes the patient is agitated and edgy and feels uncomfortable, and they're more amenable to treatment. But sometimes, a lot of times, the person in a manic or hypomanic episode feels real good. So it's hard for them to admit that they're sick and need help. They often stop taking their medications as soon as they're discharged from a hospital, or even during hospitalization, they're cheeking their pills, so you have to watch them real carefully. They also, when not in a hospital environment, tend to abuse alcohol and street drugs. Now, bipolar patients can manage their illness effectively, but it's hard. It's very difficult, and it requires a lot of motivation and hard work and support from family and friends. Unfortunately, a lot of times family and friends are burnt out by the behavior of the manic depressive patient, and so that support is lacking. There's also a support group called Ups and Downs, which was created by bipolar sufferers and manned by bipolar sufferers. So this group is very helpful because the patient is getting feedback and support from people who have been where he is, know what it's like, and have more credibility. It's a very, very difficult illness to have, not just for the patient, but for everyone around him or her. But, like I said, it can be managed. It requires a lot of support. So, if you know somebody that is a manic depressive and you're feeling burned out, don't give up the ship. Do that extra effort. Support them as much as you can, and give them feedback about their behavior. Especially if you see them heading up. If they hear it enough times, sometimes they will listen and seek help. Thanks for listening.